Please take note at this very moment, 89% of Americans over the age of 60 are overlooking these warning signs, and this could end up costing them their lives. It is likely that you are dismissing the signs of aging or stress as the cause of the symptoms you are experiencing, but your heart is making a desperate attempt to tell you something. Your chances of experiencing sudden cardiac death increase by 12 for each day you choose to ignore these warning signs. I will share 13 warning signs that could save your life tonight, but you must stay with me for the next 15 minutes. Before we get started, however, I want to ask you to click the subscribe button and enable notifications if you're concerned about your health. This is because right here is where we reveal the truths that no one else talks about. I would also like to know if you're with me. If you are watching now, if this video resonates with you, please type 1 in the comments section. If not, please type 0. You are unaware of just how important your voice is. As someone who works in healthcare, I was truly stunned by the following. Currently, there are more than 6 million people in the United States who suffer from heart failure, and the vast majority of them are unaware that their bodies have been trying to send them warning signals for months. The moments you see in movies, where people clutch their chests in an over-the-top way, are not the kind of moments we are discussing here. 94% of the population simply ignore these subtle, everyday signs, which are the ways your body is crying out for help. The information that I'm going to share with you is based on decades of medical research and data from thousands of patient cases. The fact that certain warning signs are so specific that knowing about them might actually mean the difference between living and dying is what makes them so crucial. Others are so common that you have most likely experienced them this week and dismissed them as insignificant. I want to take a moment to tell you about Margaret, a 72-year-old who lives in Phoenix. It was 3 months ago when she started needing an extra pillow in order to sleep properly. She was of the opinion that it was just a matter of personal preference for comfort. After that, she started waking up with a gasp, fighting to get air, but she chalked this up to the anxiety she felt about her grandkids. She assumed that she was simply in poor physical shape when she began to feel short of breath while tying her shoes. Margaret was suffering from 3 classic early warning signals of heart failure, but like the majority of Americans, she ignored them until it was almost too late to do anything. The scary reality is that your heart won't wait for a convenient time to fail. Months before any crisis, it begins to send out distress signals. According to medical studies conducted by the American Heart Association, those who can recognize these early warning signs and seek medical help can prevent 90% of emergencies related to heart failure. For those who do not pay attention to them, there is a 50% probability that they won't survive their first major cardiac event. It's important that I clarify that the information contained in this document is for educational purposes only and should never be used as a substitute for getting advice from your healthcare provider. With that in mind, let's get started by diving deeper into these potentially life-saving warning signs. All of the information that I'm sharing with you is backed by reputable medical research, and I will provide references to the relevant studies so you can discuss them with your physician. If you or someone you know experiences any of these symptoms, especially if they are experiencing more than one of them at the same time, please seek medical assistance right away. We will now begin our exploration of the 13 warning signs that your heart uses in its plea for assistance, starting with the symptom that is most frequently misinterpreted and that affects millions of Americans on a daily basis. The first indicator that should raise concern is experiencing shortness of breath while doing tasks that were previously completed without any trouble. This is not a discussion of the feeling of being breathless after running a marathon or climbing multiple flights of stairs. We are talking about the sense of being out of breath when you walk to your mailbox, when you climb just one flight of stairs, or when you carry groceries from your car into your house. Your heart is trying to send you a vital message. If all of a sudden you find yourself struggling to breathe after doing tasks that have never been a problem for you before, this is what is happening inside your body. Your heart muscle is unable to pump blood at a fast enough rate to meet the oxygen needs of your muscles. When you are engaging in physical activity, if it is weakened, you feel a sensation of breathlessness because your lungs are overworking themselves in an attempt to make up for the lack of oxygen. This type of exertional shortness of breath is one of the earliest and most reliable markers of developing heart failure. According to research from major cardiology facilities, this symptom is very concerning because of how it progresses. Most people adjust to changes gradually without even realizing it. You might start to use the elevator instead of the stairs, park your car closer to store entrances, or ask other people to help you with carrying heavy items. You justify these changes by blaming them on the process of getting older or being in poor physical shape. But the reality is that your heart is truly crying out for help. According to medical research, this specific symptom usually appears anywhere from 6 to 12 months before the emergence of any other noticeable signs of heart failure. The amount of time it takes to recover is the main difference between the symptoms of heart failure and regular fatigue. Healthy people recover from physical activity fairly quickly, but if you find that you need long periods of rest after activities you do on a regular basis, you should seek medical attention as soon as possible. It is possible that you will be surprised by the second warning sign because it happens when you are trying to get some rest. Orthopnea is the term used to describe the condition where a person needs an increasing number of pillows to be able to breathe properly while they are sleeping. This gradual transformation is considered unusual by many people. This is because it develops over the course of months or even years, making it hard to notice. The force of gravity no longer helps your heart pump blood back from your legs and lower body when you are lying flat on your back. When your heart is weaker, blood starts to pool in the veins responsible for returning blood from your lungs to your heart. When you are in a prone position, this backup forces fluid to leak into the lung tissue, which makes breathing more difficult. According to research conducted at major medical institutes, roughly 80 of individuals diagnosed with heart failure at the time of their diagnosis show symptoms of orthopnea. The progression is gradual and deceptively subtle. You might start with 1 extra pillow, then gradually move to 2, then 3. Eventually, a lot of people find that the only position in which they can breathe comfortably all night is while resting in a recliner. The fact that people justify this change by rationalizing it is what makes this symptom more deceptive. They blame it on allergies or sinus problems, or simply believe it's a matter of personal preference for comfort. Your cardiovascular system is trying to communicate something very important to you about the pumping ability of your heart. If you have gone from sleeping in a flat position to needing multiple pillows or sleeping upright to breathe correctly. Of all the possible warning signs, the third one is the one that is most likely to instill fear in a person. It is most often experienced in the middle of the night. The sensation of drowning while in your bed is how it feels, and it is known as paroxysmal nocturnal dyspnea. You are jolted awake, usually after 2 to 4 hours of sleep, and you gasp for air in a panic as your heart pounds in your chest and you begin to worry. Can you imagine that? This happens when, after you have been lying down for several hours, fluid that has built up in your legs during the day starts to redistribute throughout your body, including to your lungs. This sudden increase in fluid volume, which overwhelms your already damaged heart, causes you to experience extreme shortness of breath. This symptom is so severe that it jolts you from sleep in a state of terror. These occurrences compel people to immediately go to windows or doors to open them, desperately searching for fresh air. Some individuals have described their sensation as being like drowning or choking. According to clinical research, this symptom is one of the most terrifying sensations for people with heart failure, and it often results in visits to the emergency room in the middle of the night. The fact that this symptom is so often misattributed is what makes it so especially dangerous. It is common for people to attribute these events to nightmares, panic attacks, or sleep apnea. Although these conditions are known to cause sleep disturbances, the specific pattern of waking up gasping for air, especially if it is happening more often, constitutes a medical emergency that requires an immediate evaluation. Of all the warning signs, number 4 is the one that is most frequently ignored. Despite the fact that it has the potential to be the most incapacitating, it's an exhaustion so deep that even the most mundane, everyday tasks feel like a difficult trip up Mount Everest. This is not the kind of typical fatigue that can be fixed with rest. This is a fatigue that lingers even when you get enough sleep, and it makes it hard to do things you once enjoyed. Your body will make a decision to survive if your heart is unable to pump blood properly. It diverts the flow of blood away from muscles and organs that are less critical and instead directs it toward more essential parts of the body, like your brain and heart. This leads to a reduction in the amount of blood delivered to your skeletal muscles, which also reduces the amount of oxygen they receive. This can lead to severe exhaustion and weakness that can affect every aspect of your daily life. This symptom can show up months before other more obvious signs of heart failure become noticeable, according to research published in major journals that focus on cardiology. The impact it has on both exercise tolerance and recovery time is especially concerning. These days you need to take long periods of rest after going on a short walk, but in the past it would have energized you. Even the simplest things such as taking a shower, making a meal, or climbing stairs become grueling ordeals that leave you feeling drained for hours afterward. Many people are unaware of the significance of the changes they make to their lifestyles since the process is often so gradual. They start to avoid activities, turn down invitations to social events, or make excuses to avoid physical effort. They blame the issue on age, stress, or a lack of physical fitness. But this progressive drop in stamina is indicative of your heart's struggle to provide your body with the most basic needs for oxygen and nutrients. Among the early warning signs that can be observed, warning sign number 5 is one of the most conspicuous. Despite this, a large majority of people ignore it until it reaches a critical stage. The medical term for it is peripheral edema, and it refers to swelling in your ankles, feet, or legs. This is not the kind of puffiness that happens from eating salty foods or sitting for a long time. This is swelling that persists and gets worse over time, particularly at the end of each day. Because of gravity, blood starts to pool in your lower extremities when your heart is unable to pump effectively, which is a result of blood not circulating around your body as it should. Additionally, since your kidneys are receiving less blood flow, they respond to this by holding on to both sodium and water. As a consequence of this combination, fluid is forced out of your blood vessels and into the surrounding tissues. This results in noticeable swelling that can become quite pronounced. At the time of diagnosis, peripheral edema is present in about 70% of heart failure patients, according to research. In the most severe cases, swelling can start in the feet and ankles and then move upward to include the calves and even the thighs. You might notice that your socks are leaving deep marks on your skin, that your shoes are becoming tighter as the day goes on, or that rings that used to fit you well are suddenly feeling too snug. The pattern is of diagnostic importance. Swelling associated with heart failure typically occurs symmetrically, which means it affects both legs to the same degree. Also, due to the effects of gravity, this swelling tends to become progressively worse as the day goes on. This is a sign that there is a significant amount of fluid buildup that needs immediate medical attention. If you apply firm pressure to the swollen area and it leaves an indentation that remains for several seconds. It is possible that warning sign number 6 is the most objective and quantifiable early indicator of developing heart failure. The weight gain is happening quickly because of fluid retention, and it is occurring at such a fast rate that it should be a cause for immediate concern. We are not talking about the slow increase in weight that comes from overeating or the indulgences that are typical of the holiday season. This is a rapid and dramatic increase in weight that can happen over just a few days. This particular warning sign is described in great detail in the medical guidelines from the American Heart Association. If you gain 2 to 3 pounds in a single day, or 5 pounds or more in a week, it is important to contact your healthcare provider as soon as possible. This is not merely a suggestion, it is a medical emergency that demands prompt attention to prevent the development of more serious problems. This rapid weight gain is caused by the fact that your failing heart triggers complex hormonal responses that cause your kidneys to aggressively retain salt and water. Roughly 1 liter of excess fluid accumulates in various parts of your body for every kilogram of weight that you gain. Here's the surprising part: clinical research has highlighted the fact that weight gain often happens before the emergence of other symptoms that are noticeable or troubling. Although you may not have yet noticed any significant swelling or severe shortness of breath, the scale doesn't lie when it comes to fluid accumulation. Cardiologists frequently encourage patients suffering from heart failure to weigh themselves daily, first thing in the morning, and to report any sudden increases in weight as soon as they notice them. This is for this very reason. It acts as an early warning system that has the power to prevent emergency hospitalizations as well as complications that could be fatal. The 7th warning sign is often confusing to individuals since it's connected to a restroom habit that seems to have no bearing on heart health at all. The term nocturia is used to describe the condition of having to urinate more often at night than during the day. Although many people believe this is caused by aging, an enlarged prostate, or drinking fluids before bed, it is possible that it's actually a subtle early indicator of heart failure. While you are in an upright position and active during the day, gravity causes fluid to accumulate in your lower extremities. Because your heart is not working at its full capacity, it is unable to pump this collected fluid back to your kidneys for proper processing. On the other hand, when you lie down at night, the force of gravity helps to redistribute this collected fluid back into your general circulation, which causes your kidneys to become suddenly flooded with fluid they couldn't process during the day. Your kidneys respond to this nighttime flood by working hard to get rid of the excess fluid. As a result, the amount of urine produced during the nighttime hours is significantly higher. Nocturia, which is defined as the need to urinate at night, is one of the earliest signs of heart failure that can be detected, according to research published in cardiology journals. In some cases, nocturia can appear months before more obvious symptoms like shortness of breath or visible swelling become apparent. Patients often say that they wake up 3 to 5 times per night to urinate, and that each of these episodes is accompanied by the production of an unusually large volume of urine. This pattern is very important because it indicates your heart's failure to effectively manage the distribution and processing of fluids over a 24-hour cycle, which would be considered normal. Disturbances in sleep are a symptom listed as the 8th warning sign, and it is frequently blamed on a variety of causes except for heart problems. The cough is one that is chronic and tends to happen most frequently while the person is lying down or at night. This is not the dry cough linked with allergies, nor is it the productive cough associated with respiratory infections. People often describe it as a persistent dry cough that keeps them from sleeping. It also seems to get better while they are sitting upright. Orthopnea and this nighttime cough are both caused by the same physiological process. When you are lying down, fluid that has built up in your body during the day as a result of your daily activities redistributes itself. This can lead to a minor buildup of fluid in your lung tissue. Coughing is the normal response of your respiratory system when it senses what it believes to be a blockage or irritation in your airways, and it is an attempt to clear the irritant or obstruction. This cough is described in medical literature as being typically more severe during the early morning hours, and it is sometimes accompanied by a faint wheezing or whistling sound. On a regular basis, patients report that the cough produces little to no phlegm or that it occasionally brings up frothy mucus that is pink or white in color. These are both clear indicators that fluid is in fact present in the lung tissue. The fact that it is so easy to incorrectly assign the symptom is what makes it so especially misleading. People blame it on allergies, post-nasal drip, dry air, or the conditions in which they sleep. They try to resolve their sleep issues by switching pillows, using humidifiers, or taking cough suppressants, but they never consider the possibility that their heart could be the source of the problem. Dealing with the rhythm of your heart is the subject of warning sign number 9, which can be an important resource for providing early warnings about the possibility of heart failure in the future. When you are in the early stages of heart failure, your heart begins to work harder and harder to adequately pump blood throughout your entire body. As a result, you may experience palpitations, which are sensations that feel like your heart is fluttering, racing, or skipping beats. As your heart muscle gets weaker, it frequently has difficulty maintaining sufficient blood flow, which causes it to develop irregular beats. It is possible that you will get the feeling that your heart is beating very rapidly, even when you are completely relaxed, or that you will have the unsettling impression that your heart is missing beats or doing somersaults inside your chest. There are individuals who describe the feeling as though their hearts are trying to escape their bodies. According to research conducted at major cardiology institutions, there is a bidirectional relationship between heart failure and cardiac arrhythmias, especially atrial fibrillation. Heart failure can result from irregular heart rhythms, and heart failure can cause arrhythmias that are potentially life-threatening. This creates a cycle that is potentially harmful and can quickly worsen if it is not detected and treated in a timely manner. Palpitations are usually most noticeable while a person is resting or lying down, and they may be accompanied by feelings of anxiety, restlessness, or a general sensation of unease. Palpitations can be caused by many factors, but if they occur along with other potential symptoms of heart failure, they should be evaluated in detail by a cardiologist to rule out the possibility of serious underlying issues. The 10th warning sign might be very unsettling because it affects your sense of balance and your brain. Many people attribute the symptoms of dizziness, lightheadedness, or near-fainting episodes to a variety of factors when they can actually be early warning signs of heart failure.
The reason you experience these symptoms is that your heart has become weak and is unable to pump a sufficient amount of blood to maintain the necessary blood flow to your brain. This is especially true when you are doing physical activity or when you are changing positions. Your cardiovascular system typically responds to times when you stand up suddenly or engage in physical activity by increasing your heart rate and altering the tone of your blood vessels. These actions are carried out to keep your blood pressure at a steady level. However, if your heart is not functioning correctly, it will not be able to make these crucial adjustments effectively. This can lead to temporary but significant drops in the amount of blood flowing to your brain, which can cause you to feel dizzy or lightheaded. Clinical studies have shown that roughly 20 of heart failure patients experience fainting episodes. These episodes can sometimes happen months before other, more obvious symptoms appear, making them an early warning sign of heart failure. Quick movements, standing for long periods, or light physical activity that would not have previously affected you are common triggers for these episodes. Misattribution is what makes this symptom especially concerning compared to others. Dehydration, adverse reactions to medications, problems with the inner ear, and low blood sugar are all common causes of dizziness that people often point to as the culprit. Dizziness, when experienced with other possible signs of heart failure, indicates a significant reduction in your heart's ability to pump blood efficiently, even though these conditions can certainly produce similar symptoms. Although warning sign number the 11th of May seem entirely unrelated to cardiovascular health, stomach issues can be significant early indicators of developing heart failure. If after eating just a small amount of food, you find yourself experiencing a persistent feeling of discomfort or fullness, a decrease in your appetite, or abdominal bloating, these symptoms could be indicative of a problem in your circulatory system that is affecting your digestive organs. In addition to impacting the muscle of your heart, heart failure affects your entire circulatory system, including blood flow to your gastrointestinal tract. This is why these symptoms happen. When your heart is unable to pump blood adequately, the amount of blood that flows to your digestive organs is drastically reduced. In addition, fluid may accumulate in your abdominal cavity, and your liver may get congested with blood that isn't being circulated through your system as efficiently. As a result, a series of digestive issues follow, which can have a significant impact on your quality of life and nutritional status. It has been demonstrated through research that these gastrointestinal symptoms are often overlooked by both patients and healthcare providers because they seem to have no connection to cardiac problems. This leads to delays in diagnosis and treatment after eating only a few bites of food. Patients who are experiencing these symptoms have reported feeling uncomfortably full, having a constant feeling of nausea without any clear explanation, or experiencing a prolonged feeling of bloating that doesn't go away with conventional treatments for digestive issues. Heart failure can cause the liver to become congested, which can lead to pain or pressure in the upper right quadrant of your abdomen. Of all of the early warning signals of heart failure, the 12th one is the most revealing. However, it is so specific that most people are unaware of its existence. Bendopnea is the name given to the phenomenon of experiencing shortness of breath within 30 seconds of bending forward. This occurs while you are in the process of tying your shoes, when you are picking something up from the floor, when you are bending in sync, or when you are bending down for any other reason. The first documentation of bendopnea in medical literature happened in the year 2014. Studies conducted since then have shown that it is an extremely specific sign of increased pressures inside the heart. The pressure inside your abdominal cavity is elevated when you lean forward. This increase in pressure causes your diaphragm to be pushed upon, which in turn causes a temporary increase in pressure in your chest cavity. If you are already having difficulties with your heart due to high filling pressures, this extra mechanical stress might soon cause you to develop shortness of breath, which can feel quite alarming. According to research published in major cardiology publications, almost 30 of patients with heart failure experience bendopnea, which is strongly associated with more advanced illness and an increased risk of catastrophic outcomes. Researchers consider the symptom to be a non-invasive way of evaluating pressures on the heart. This is because the symptom is so reliable in terms of diagnosis that it eliminates the need for invasive testing methods. The specificity of bendopnea is what makes it especially important for early detection of the condition. This symptom is rarely seen by those who are in good health, which means it is a warning sign that needs prompt medical intervention. Changes to your circulation, which you may be able to feel in your hands and feet, are the subject of the 13th warning sign. The possibility that your heart is not pumping with enough force to maintain proper circulation throughout your body is indicated by the constant feeling of coldness in your hands and feet, even when the weather is warm, as well as by variations in your pulse pressure. Your cardiovascular system will immediately reduce circulation to your extremities if you develop heart failure, since it will prioritize blood flow to the organs essential to your survival, such as your brain and heart. As a result, the hands and feet are constantly cold, and there may be a bluish tint to the lips or fingernails. In certain cases, you might see that your hands and feet remain cold to the touch even when you are feeling warm, or that it takes them much more time than it normally would to warm up. The detection of narrow pulse pressure, which is a more subtle indicator, requires that blood pressure be monitored. It is typical for the difference between your systolic and diastolic blood pressure readings to be at least 40 mm of mercury. When this gap becomes noticeably smaller, it may be a symptom of a decrease in stroke volume. This means your heart is not pumping out enough blood volume with each beat, which can lead to serious health problems. According to medical studies, these changes in circulation often occur over time and can be considered early warning signs of diminished cardiac output before symptoms that are more readily apparent begin to show up. The changes occurring in your body are a result of its effort to maintain circulation to the organs essential for survival, even if it means sacrificing comfort and function in your extremities. If you have recognized yourself in any of these 13 warning signs, please do not be alarmed, but it is equally important that you do not ignore the signals your body is sending you. If heart failure is diagnosed in its early stages, it is completely possible to manage the problem by making changes to your lifestyle and seeking proper medical care. It is essential to be able to recognize these subtle signals your cardiovascular system is giving and to take appropriate action before a medical emergency happens. You'll see why this matters in just a moment. The most important thing to remember is that these symptoms often develop so gradually that it is simple to ignore them or attribute them to factors like stress, a lack of physical fitness, or the natural aging process. On the other hand, if you start to experience several symptoms at the same time, or if activities that used to be easy become surprisingly hard, then there is a good chance that your heart is trying to tell you something essential regarding its health. If heart failure is detected and treated early, it can have a significant positive impact on your quality of life and long-term prognosis. There are a wide range of resources available in modern cardiovascular medicine to help in the efficient management of heart failure. These resources include medications that can strengthen your heart muscles, as well as lifestyle modifications that can slow or even reverse the progression of the condition. Your heart will be able to pump more efficiently. You will have a reduction in fluid retention, and your energy levels will be higher if you take advantage of the drugs available today. Changes in lifestyle, such as adjustments to one's diet, the implementation of exercise programs that are appropriate for the individual, and weight management can have a significant impact on the symptoms and progression of heart failure. Since we all grow when we share, we would appreciate it if you would tell us what you learned today and what changes you are willing to make in the comments section below. We can all help each other. If this video was beneficial to you, or if it even slightly altered your perspective, please click the like button. To ensure that you do not miss out on any information that could potentially affect your health, click subscribe. Before you leave, please do not forget to turn on the bell. Please enter 1 if this video was useful, and if it was not, enter 0. You might not realize how vital your comment is. Keep in mind that your heart has been working continuously your entire life without you ever having to give it a second thought. The moment that it begins to send these warning signals, it is imperative that you give it your immediate attention and respect. Do not wait until you experience extreme symptoms or until an emergency arises before you seek help. We ask that you kindly consider sharing this information with family members and friends who could benefit from being aware of these early warning signals. If you find this information to be useful and potentially life-saving, early diagnosis saves lives, and you have the potential to help someone avoid a cardiac emergency that could have been prevented. It is important to remember that this material is provided for educational purposes only and should not be considered a substitute for professional medical advice. If you are having any of these symptoms, especially if more than one of them are occurring at the same time, you should seek medical attention from your healthcare provider as soon as possible so that you can be properly evaluated and treated. We appreciate you taking the time to learn about these essential warning signs and for actively participating in protecting your cardiovascular health. Your heart works around the clock every day to keep you alive and healthy. Therefore, it is essential to be aware of when your heart needs help, as this is one of the most important things you can do for your long-term health and well-being. Thank you for watching. I'll see you in the next video. Please don't forget to subscribe and click on the notification bell so you never miss new videos.